Well, hello, and welcome to Ask the Doctor. I'm Glen Macnow. Joining me today, Dr. Frank Caputo, vascular surgeon. Dr. Caputo, nice to meet you.
Hello.
The doctor is going to answer the questions that you have submitted on peripheral vascular disease, PVD, commonly known as circulation disorders. So let's start with the basic, Doc. What causes circulation disorders?
Depending on what part of peripheral vascular disease you're talking about, the one that we most commonly talk about is peripheral arterial disease, and that's what's caused by our parents' influence, parents with the heart attacks, the carotid disease, our high cholesterol that comes from good eating, that
Good eating or fun eating?
That fun eating.
Yes.
And all the fun stuff we did in life, the smoking, the watching TV. So those are the things that will lead to circulation disorders that we often talk about.
All right, so then let's get a little bit specifically into some of these factors. You mentioned the good eating, so it's cholesterol, that's what we're talking about?
Cholesterol, triglycerides, your lipids, it's multifactorial, and some of it you can't escape the genes from your parents, right? Mm-hmm. But a lot of it's stuff that we can modify.
All right, so you'd recommend what, a lean diet, a lot of fiber, a lot of fruit?
I recommend everything in moderation for the most part.
I can have my occasional cheeseburger.
You can have your cheeseburger.
Thank you.
Just don't follow it up with 10 wings. So.
Oh, you saw me last Friday.
But the key comes down to is try to be healthy as much as possible. When you want to go for a walk, go for a walk. And do that at least a couple times a week. Mm-hmm. Eat healthy most of the times of the week, but don't be afraid to splurge. We have to live too.
Okay. So you mentioned our parents. So it leads me, I guess, to the question of demographics. Does that play a factor? If you're from a particular group or upbringing or racial background, is that a factor at all?
That's a great question, and there is a ton of research being done right now. There's a lot of comparative analysis being done, not just on race, but also on gender. Mm-hmm. And there's some data coming out that we are actually researching here that, females might have a very virulent form of atherosclerosis later on in life that we're trying to tease out of the data. And, some racial demographics are more likely to have diabetes, which might lead to worsening peripheral vascular disease, whereas a lot of times it comes down to your own genetic family background.
Okay. Which leads to a question that one of our listeners sent to the website, and it's that this person says, my mother's being diagnosed with PVD. Does that mean I'm going to get it?
Nope. So depending on what your mom's risk factors were, a lot of it could be my grandmother. She was 75, right? She smoked 2 packs of Marlboro Reds a day. She didn't walk. She didn't do anything, right? So yeah, she has peripheral vascular disease. My dad, healthy guy, all-state baseball player, everything, healthy. Doesn't have 1 ounce of it. So a lot of it depends on what your parents did and how they chose their lifestyle.
Right. What are some of the symptoms that people should look for?
So the most common symptom is having no symptom at all.
Oh.
So it's going to your...
Well, I've got that.
But actually, going to your doctor who does an exam on you and says, I don't feel many pulses in your feet, or I don't feel anything, so you better get checked out. Mm-hmm. And then lo and behold, they do some ultrasounds, which is a diagnostic test. But the symptoms that most people will talk about is claudication. And claudication actually comes to mean to limp. And it's the person that walks 100 yards and starts feeling like Charlie horses in your calf. Mm-hmm. Like you've been working out and running a mile, but you've really only been walking a half block. Those are the symptoms.
Okay. Well, somebody says something. We got a question kind of along those lines. Tell me if this relates. Somebody said, my arms and legs are always cold. Does this mean I have a circulation disorder?
Nope. So it does not necessarily mean you have a circulation disorder. There's a whole host of things that can cause that. A lot of it can just be the way your nerves are wired. Mm-hmm. You may just be one of those people. There are certain circulation disorders that can cause that. Most of the time they're on one side of the spectrum, meaning pretty severe. Fingers turn blue, then they turn white, then red. But to feel cold in your legs and your arms, it's not.
My wife always putting on a sweater. Whatever time of year, putting on the sweater means nothing. Good. I feel a lot better. Okay, I'm going to pronounce all these, Dr. Caputo. So we're talking about peripheral vascular disease. Let's talk about peripheral arterial disease, PAD. What's the difference between the two?
So what we've been alluding to most of the time we're talking in the last couple of minutes was peripheral arterial disease. Peripheral vascular disease is just a coin used to encompass all vascular disease outside of the heart and the brain.
Mm-hmm.
All right, so that not only includes your arteries, peripheral arterial disease, but
Mm-hmm.
also your veins, your lymphatics, and all the morbidity that goes associated with those systems as well. Peripheral arterial disease is more of a subsegment of peripheral vascular disease. It's often used interchangeably, so it kind of gets very confusing, but to be specific, that's the difference.
Okay. So people write in with questions, and somebody said, I've got, if I pronounce it right, venous stasis leg ulcer, Venous, how would you pronounce that?
Venous stasis.
Venous stasis, well, I got none of the words right. Venous stasis leg ulcer, what do I do? First, let's talk about what that is, and then what that person should do.
So venous stasis is pretty much a disease of the healthy most of the time.
Mm-hmm.
You take me, I'm 6'2", right? So it's very easy for me to get the blood from my heart to my toes.
Mm-hmm.
Well, getting back from my toes to my heart is a little harder. We don't have gravity helping us. I don't have a pump helping us,
Mm-hmm.
right? So if you take time, us getting bigger sometimes,
Mm-hmm.
getting a little weight, having kids, not me and you, but
Yeah.
our female counterparts, you get a propensity to have malfunctioning veins. And what I mean by that is your veins have been specialized over time to have valves in them, and they act like a ladder. They actually check flow, like almost like a roller coaster. You're at a roller coaster, you hear chunk, 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 chunk. The veins, the blood in the veins also do the same thing. They ride that ladder with no backward flow.
Mm-hmm.
But as time goes on, those valves become loose, and the blood goes up, comes back down, and it becomes static or stasis.
Okay.
As it becomes static, your veins bulge. You try to find other ways to get the blood back up to your legs. You start getting ulcers because the blood is causing increased pressure, and lo and behold, you have venous disease.
Okay, so talk about treating that, or treating, once you're diagnosed with PVD, how is that typically treated?
Venous stasis, well, the first thing you would do is manage the ulcer,
Mm-hmm.
and that's through multiple different types, whether it's compression versus procedures, namely ablating the vein, but that would only be in circumstances where the veins malfunction, and that can be easily done with an ultrasound test.
Okay. Someone asked the question, if I have PVD or PAD and it's untreated, what might happen?
Well, believe it or not, they've done these studies multiple times, and if you have untreated peripheral arterial disease, nothing's going to happen to you as long as you're asymptomatic. Okay? So, or even if you're asymptomatic, if you're claudicating, you have a higher likelihood of having something else go wrong with your heart or your brain.
Claudicating
Claudicating
means?
to limp.
Okay.
Claudicating means you're walking and your calves hurt when you walk a certain distance.
Mhm.
It's attributed often to arterial disease or
Okay.
peripheral arterial disease. Can easily be found by just doing simple, what they call ankle brachial indexes,
Okay.
which is blood pressure cuffs on your arms and your legs, and just measuring the difference. And what we know is if you're just claudicating, meaning if you're just,
Mhm.
the question everyone worries about is, am I going to lose my leg? Right?
Yeah, sure.
That's what everyone worries about. They come into my office, am I going to lose my leg?
I was born with two of them. I'd like to go out with two
Correct,
of them. Yeah.
right? 2 legs, 10 toes.
Mhm.
And what I tell them is, now is like a warning sign. Now it's time to start getting healthy, right? Stop the good eating or the fun eating, and start going for walks and getting healthy. What we know is, if you are just claudicating, limping when walking, from arterial disease, if I take 100 patients, only 5 will go on to progress to needing surgery to save their legs
Okay.
over 5 years.
Okay.
But I can tell you, if I take those same 100 patients, 20 of them will end up developing a major cardiovascular event, heart attack or stroke. So what makes peripheral arterial disease unique is that although it may affect your legs, it's also a marker of other processes going on in your body, your
Mhm.
heart and your...
All right, so then I guess let's close with this. When do I know, or can my primary doctor care and treat this, or when do I know that I need to see a specialist?
Well, the primary care doctor is the one that is going to recognize this, identify it, and they will get you plugged in with a vascular specialist. The unique thing about vascular surgery is most of my patients don't require surgery.
Mm-hmm.
I'm following them, I'm doing surveillance on them, I'm doing medical therapy with them, and when the time comes and they need surgery, I'm here to offer them both minimally invasive and open surgery as needed.
Thank you, Dr. Caputo. Thank everybody for your questions and your time. To learn more about the vascular program at Cooper or to see Ask the Doctor videos, more Ask the Doctor videos, please visit cbsphilly.com/CooperDocs.